So Sharon and I thought, in the spirit of St. Patrick's Day and springtime, that we should stay with the green theme, right? So things that are green. So most of you know us. My name is Cari Shulkin. I'm one of the nurses.
I'm Sharon Myers. I'm also one of the nurses.
And so happy March. Spring is in the air. Everything is green and blooming. Today's lecture is very important. We want you to know that sometimes things that are green can be a red flag when we're talking about our bodies. We want you to be able to identify what is a serious problem that should be reported to your doc before it becomes a bigger problem that may affect your health. So having said that, there is a disclaimer. Some of the facts discussed and graphics used in today's lecture may affect your appetite. And
Don't do it.
And we are not kidding. We are not kidding. So on that note, anyone a little queasy, you're dismissed.
Let's eat first.
So exudate, what is it? Has anyone even heard of that term before? Nurses have. Anyone?
Something comes out of your body, maybe?
No. It's basically drainage. So that's a pretty word, right? So nurses, it's a medical term, exudate. So what is it? Like when we have drainage, and it makes me think of you, Tom, had a little bit, yeah, that didn't sound right, did it? I don't think of you when I think of exudate. I think of the problem you had with your wound,
Close up.
Yeah, just wouldn't close up, and he had a little bit of drainage. So when you have any type of tissue damage and there could be some drainage from it, what exactly is coming out of your body is just this fluid. It's a mass of cells that seep out of your blood vessels or an organ, especially during an inflammation or an injury. So Tom's, do you mind me? Do you want? Okay. He had a pacemaker placed, and so there's a little cut. And it doesn't matter if it's an injury like you get punched or if it's a surgical incision, that's an injury to tissue. And so in response to that is a very normal response, whether it's inflammation or injury, however you want to look at it. But these cells kind of accumulate and then seep out. And when you kind of really look under a microscope, you can't look by telling. It's kind of a cloudy appearance. It's actually cell debris. It's inflammatory cells. It's cells that have broken down. That's what's seeping out. It's usually a very high protein count as well. So exudate is a fluid produced by a wound as it heals, and it's a normal part of the healing process. Okay. So that's the best case scenario. So there is different types of exudate or drainage. So there could be a very clear, have you had an injury where you see kind of a clear drainage? That's what we would call that serous. It's clear, thin, watery fluid. Normal, totally normal. And then there's a serosanguinous drainage, which has maybe a slightly red or a pink hue to it, and there's just a little bit of blood with it. And I think, Tom, yours was kind of a serosanguinous.
Kind of brown.
Had a little bit of, yeah, okay. And then there's a sanguinous, which is like bright red or fresh blood, which can kind of be a red flag if you're having a lot of a sanguinous drainage. And then there is the purulent drainage, which is kind of thick and opaque, may have an odor to it, and it's kind of very indicative of an infection. Okay, so we're talking about green, right? So when green is bad, so any nurse in the building, Sharon and I, we have seen drainage like this. kind of that, you pull back, a patient that may be in the hospital or in the clinic, and you see this green drainage and this is not good. This is not good. Green is bad. And it's this purulent, it's signs of infection. I'm getting a little queasy just even talking about this because I can almost smell. We don't have smell-o-vision, but as an experienced nurse, we know what this smells like. And it's not good. So green is bad. Green is definitely reportable. So when we have colors of purulent wound drainage, like yellow is kind of pus. It's that beginning of infection. It's the debris of cells. When we've got anything green, we're thinking of a bacterial infection. And so a lot of times as patients in here, you will ask us, oh, I'm coughing up stuff, or I've got this, will you look at this wound? And we'll always ask, well, what color is it? Because color matters to nurses, because this is what we're thinking of. This is what's going through our head. Is it yellow? Is it green? Is it brown, which could be a mix of advanced infection or even a grayish in color, a purulent drainage that is gray in color, could be a mild infection or healing. But we know as nurses that some of this stuff may be reportable, or you need to go see your doctor and get on some antibiotics before it becomes something worse. Any questions? Does that make sense? Has anyone had a wound that had green drainage? Okay. Yeah?
Yeah, I got hit by a car after my knee replacement.
Yes.
So when the car hit me, my knee hit the dash.
Oof.
And so it opened it up.
Yeah.
I have a picture at home. It's very gross.
Yeah.
It's in between yellow and green.
Okay.
Colors.
Okay. I hope it's framed.
I don't even like looking at it. Oh, it's gross.
So green, purulent drainage, that's thick, often foul smelling, green tinted fluid from a wound, indicating a serious bacterial infection, usually Pseudomonas. It requires immediate medical attention to prevent that infection from spreading or becoming life-threatening, meaning sepsis, or becoming chronic. So treatment involves antibiotic, wound cleansing, potential debridement, which is when you go into the hospital and just a second, and have the doctors sometimes under anesthesia, sometimes not, but cleaning out that wound, scraping and cleaning out all that drainage, all that infection by a healthcare professional. Yeah, Leonie.
What color would it be?
You would still see the green. Yeah, it's not like primary colors. We're not mixing and matching and then getting a different color. If you had a green, odorous, thick, you would see that within bloody drainage. So that's why we as nurses ask what color. So I hope that brings it home. We're not weird. Well, I'm not. Because we want to know what's the next step. And it looks good, it looks okay, or it's time to see the doctor. Call today. That's what we're doing.
Question.
Oh, question. Where?
Just a
Oh.
comment.
Oh, no. Oh,
One of the neat things about the current environment that we live in is with the cell phones, you can take pictures. And I did that and I kept sending it to the doctor. He kept looking at it and it's easy. I didn't have to go in.
yes. Thanks for bringing that up. Someone in here, we took a picture. I can't remember who it was. I took a picture of somebody's something. I don't remember what it was. And we sent it to the doc. I don't know.
A lady had skin thin on her leg. And
Yeah.
I was saying one day you were looking at it.
Did I take a picture of it?
I don't know.
I don't
You told her
remember.
to go to the doctor.
Ah, well, it's a good thing to say.
Your memory lecture was last week.
Oh, Lordy, I didn't encode it, Tom. Dang it. But any other questions about exudate? So now you know if the doctor says, yes, this patient has exudate and it's green purulent, you'll know. I know exactly what you're saying, and I want antibiotics now. Okay. So now you know. Any questions? You
Yeah.
want to?
Switch chairs.
Oh, okay. Oh my God.
Are we gonna do this too? The whole
I
thing?
think so. It's good for us. Exercise. Okay, so now I've been assigned by Cari to talk about green sputum. And I'm telling you, green sputum is not what we want to see. We do not want to see that, but occasionally Cari and I have seen it. So what is sputum? Have you heard that term before?
Yes.
Yeah, you've heard of it. Yeah. So it's also called phlegm, right? That's more of a common term. Same thing. It's different from saliva because saliva is secreted in our mouth, and this comes from deeper down in our lungs and our lower airways. And it's, it deep down there is where this sputum or this phlegm is used to trap irritants and germs and that kind of thing. So I'm going to talk about the different colors of sputum or phlegm and what they mean. And some of these colors I haven't actually seen. So white is just normal. It's just, some people just make more phlegm than others. It just kind of depends on your genetics and how much phlegm you make. And some people hardly make any phlegm. So some people are kind of coughing up a little bit of phlegm a lot of the time. It's clear, it's not thick, and they just swallow it. And then there's also ones that it can be considered to be more in need of seeing a doctor about. So black, I've never actually seen black sputum. Have you seen that?
People who smoke sometimes have a very, very dark sputum.
Smoking, and also if you have some sort of fungal infection, you can get black sputum. So if you have that, that's something you want to see your doctor about because it's likely that something may be going on. Brown sputum can be chronic infections or conditions like bronchiectasis. People that have kind of chronic bronchitis can get some irritation in their parts of their lungs and their bronchioles, and there can be a little bit of bleeding and old bleeding, and you can see some brown sputum. Yellow or green is what we're going to spend the most of the time talking about, and that's usually a sign when the body is fighting an infection. It doesn't mean that you have an infection. It could just mean that you're getting there or that your lungs are inflamed. It's a sign of inflammation. And then pink or red is presence of blood in the sputum. That can be secondary or you have an infection and that causes such an irritation in your lungs that then you get some bleeding from all the coughing that you're doing and all the irritation that you can end up with some blood in your lungs and coughing that up. It can also be from cancer and certain cardiac conditions. So green basically means your body's fighting an infection and there is inflammation. The immune system has been triggered and is fighting back. So that's all that green sputum means. So there's different medical issues that can cause green sputum. So bronchitis is a very common one, and that's more common as we get older to get bronchitis. And bronchitis is usually caused by a virus. It usually begins with a dry cough and clear sputum to begin with, and then it may progress where you're seeing more yellow and green phlegm, and that can mean that you're starting to get an infection. My mother used to get, I don't know, 2 or 3 times a year bronchitis, and it would always start with just a little dry cough, and then she would just start coughing up kind of this clear stuff, and then it would go on, and by about a month, it would turn into an infection, and she'd start coughing up more green sputum. And then pneumonia is another cause of green sputum, which is an infection in your lungs caused by bacteria, viruses, or a fungus. So you can have a bacterial pneumonia or a viral pneumonia or a fungal pneumonia. It can be caused, you can get pneumonia secondary or because you've had something else going on, such as you've had COVID. You could have COVID to start out with, and then you could end up, especially if you're older, with a case of pneumonia. You could start out with a cold and have pneumonia secondary to that. You could aspirate, what does aspiration mean? What? Oh, well, we'd like if you aspirate, we would like to vacuum it out. But aspiration just means that say you're drinking something and you're talking to somebody and you don't realize it, and instead of the food or the liquid going down into your stomach, down your esophagus, it goes down your trachea and into your bronchioles and into your lungs. And if you don't cough it out there, and if you're in a weakened state, especially, you can end up with an infection in your lungs from aspirating or taking in a food or a liquid that goes into your lungs rather than into your stomach. Common symptoms of pneumonia are chills, fever, uncontrollable coughing, shortness of breath, fatigue being one, loss of appetite, sharp pain in the lungs when taking a deep breath. So I'm not going to spend a lot of time on this, but the difference, both pneumonia and bronchitis occur in your lungs, and bronchitis occurs mainly in the tubes. So these right here, the trachea comes down, and then these little tubes that are on the side, that's where that's what gets inflamed with bronchitis. And in pneumonia, it's in the lung tissue. So actually in the sacs of the lung. So it's further down. And the main way that you can diagnose this is by looking at an x-ray. And on x-ray, you'll see all the lung tissues just looks like a cloud in your lungs. And in bronchitis, you might see some inflammation in the bronchioles or the tubes coming down.
At that last big flu last month.
Yes.
And it did go into pneumonia at one point. Started out not at.
Yes. Uh-huh.
So it was a viral, not the fungal, I think, because it cleared up pretty quickly.
It was a viral, not a bacterial.
Not a bacteria.
So they didn't give you any antibiotics.
But I thought may have had.
They maybe weren't sure. Yeah. Sometimes if they're not sure. Mm-hmm. So another cause of green sputum is sinusitis, where especially this time of year, we have allergies, our sinuses can get inflamed, and kind of depending on our anatomy, some people are just prone to getting sinus infections when they get an inflammation in their sinuses. And it quickly turns into like green drainage. They have severe headaches, pain in their cheeks. And every time the spring comes, they know that they need to go see the doctor because they probably got an infection in their sinuses. Symptoms are yellow or green phlegm, postnasal drip, nasal congestion, pressure in your sinus cavities. When to call your primary care physician. If you have a fever with your sinusitis and you have facial pain and it's getting worse, it's not getting better after a week or so. And then another cause of green sputum, which Cari and I have seen a lot in the hospital, is called cystic fibrosis, and it occurs, you mainly see it initially in young people, and it's a genetic lung disease which causes people to just develop a lot of thick mucus all the time. And it can, of course, if you have this chronic development of thick mucus, you can imagine that it causes other health problems in your lungs. It makes you more prone to pneumonia and viruses and all those kinds of things.
People get over that?
No, but people used to die at a very young age, and now they can live to quite an old age because of the new medicines that they have that reduce the amount of mucus that you're creating. So things have really improved. So green phlegm, is it bad? When to seek medical attention? Sometimes green sputum doesn't mean much. Like when I get a cold, sometimes I'll get some green sputum and it just lasts a day or two and it's gone. So when is it time to call your healthcare professional? If you're having difficulty breathing or shortness of breath, if you take your oxygen saturation and you're sure it's accurate, have us check it, and it's less than 92%. That's an indication that you're really not getting good perfusion in your lungs of oxygen. If you're having chest pain or pressure when you're taking a deep breath or when you're coughing, a persistent high fever that lasts more than 3 days, symptoms that last in general longer than 7 days are getting worse, you're not getting better. Coughing up blood, rust-colored phlegm, and if you're having wheezing. Anybody had any of these in the past when you know you need to call your doctor? Anybody?
What happens when you swallow the green?
It just, it can make you a little nauseated, but basically you have digestive enzymes in your stomach that just break it down, I think. Yeah, not really.
Harry's favorite topic.
Okay. On the subject of green in our bodies, we have green stools sometimes. Okay. Does color really matter in our stools? Oh, yes. So let's talk about it. What? We're talking about poop. Okay, so if it's green, a lot of times food may be moving through your large intestines too quickly, like due to diarrhea. And if you have diarrhea, a lot of times it can be green. As a result, bile does not have time to break down completely. Okay, and more than likely, that's kind of what's happening, is that stuff is just moving through too quickly. But there could be some dietary causes as well, like eating a lot of green leafy vegetables or green food coloring, such as flavored drinks or ice pops. Some iron supplements as well can change the color of your stool. But more than likely, it's just fighting a little bit of a virus and you have a little bit of diarrhea and everything's going through too quickly and you experience green stools. Light colored white or gray colored stools, that's indicative of a lack of bile in the stool, and this may indicate a bile duct blockage. So let me just back up a little bit. If you have a day of having green stools or a day of having light colored, clay colored stools, not anything to get crazy about, but if it persists, it's definitely something to be evaluated, right? Because it's not normal. And so it's definitely a call to your physician to let him or her know. There could be some dietary causes of having a light colored or clay colored stools as well, because certain medicines, especially like antacids or like kaopectate or Pepto-Bismol, those are anti-diarrheal drugs. Or even if you've had like an upper GI or a lower GI and they use barium and it's expelled in your stool as well, that will look gray colored as well, clay colored. Yellow or greasy, foul-smelling stool is usually related to excess fat. Like there may be a malabsorption condition, like celiac disease. Even if you've eaten something that's very, very, very high in fat, very greasy, you can sometimes see that in your stool as well. Just like little dollops of grease in the toilet bowl itself. So dietary fatty foods such as deeply fried foods and sometimes protein, gluten, such as in breads and cereals can cause this as well. Okay, now let's talk about some stuff that can be a little scary, like having black stools, which is really not very common at all, but it's definitely a red flag because that could mean that there's bleeding in the upper GI, like probably in your tummy, the upper gastrointestinal tract, such as in your stomach. So black tarry stools, it's a sign of digested blood. Okay, and so that is something that your doctors should be notified of. Okay. Some irons, it should still be, if you're not taking an iron supplement or you haven't had kaopectate or Pepto-Bismol or black licorice, those can cause, but not quite the same as a black tarry stool. It's definitely a red flag to let your doctor know because any type of bleeding should be evaluated. And then there's bright red stools, and that's bleeding in the lower intestinal tract, such as in the large intestines or in the rectum or from hemorrhoids. But any bright red bleeding is definitely reportable, right? It's not something, sorry, that you sit on. It's something that should be reported right away because if you are having bright red bleeding, you can get to a point where it's not going to stop. And then that's going to be a life-threatening situation. Some foods can make it look like it could be blood, but probably not quite the same. If anyone has had, or if you're a nurse, smelled bloody stools, it is a smell that you will never forget, ever, right?
Right.
Yes. So some food stuff can make your stools look red, but it's not the same odor. So like red food coloring, beets or cranberries, tomato juice or soup, red gelatin or drink mixes. There may be some red colors in your stool for that, but you can't mistake that for blood because blood is definitely a reportable symptom. So, colors of the rainbow. Little did we know, right? But the things I do want to focus on, is, our poop should just be brown, right? And so if it's not brown, it's our body telling us something. And so hopefully you know a little bit more about your stools and what would be reportable. And so I just want to kind of look at those bottom ones again. It's that black or dark red or maroon or bright red color, which is blood. Any of that is something you need to talk to your doctor about immediately. Or if you're bleeding from your rectum, that's an ER visit for sure.
And
Okay.
many of you are on blood thinners, so it
Oh,
could
good
very
point.
likely be something to watch out for if you're on blood thinners, if you're having blood in your stools and you're seeing that you're having black
Or even
red.
black, yes. Higher up, bleeding in the stomach. Any questions?
One up here.
Yeah.
I was told by someone they were sort of a medical practitioner, but they were very much into macrobiotics, that poop should be orange. Don't know. That was like 15 years ago, I think. So I remembered that, but it's
Orange is not even in this rainbow. Do we need to add a color?
What's your carrot intake like?
Yeah, how many carrots?
cigarette smoking wasn't bad if most color.
Okay, right there discounts a lot. Anything that follows that.
Yeah.
Yeah. Okay.
Okay. Switching.
Yeah.
So what is something we've been talking about green stuff? We're going to continue on. So what is something in your body that is green all the time, even when you're healthy? Yeah. Your what? Your boogers? Oh. Well,
Yes, Sharon.
well, you get a brownie point for that.
A greenie point.
A greenie point. Yes, the gallbladder. I was going to give you guys a hint. Here's a hint. Everybody know what that is? That's the gallbladder and the ducts that come from the liver. And here's the gallbladder. Look, it's green. And it's green mainly because it's filled with bile, which is green. So the gallbladder sits right below the liver, right next to it, and there's little ducts that connect the gallbladder to the liver, and the liver makes bile. And when it makes bile, it stores it in the gallbladder, and then there's little ducts that go from the gallbladder into the small intestine. And so when you eat something, then bile goes there to help digest the food and break it down.
Why is the gallbladder not very important? Just take it out.
Well, your liver, it is important because it stores the bile and it makes it really easy to get into the small intestine. But people who have their gallbladders removed, their liver is still making bile. And instead of it being stored, there's ducts that go directly from the liver into the small intestine. And when you first get your gallbladder out, that whole system there of going directly from the liver into the small intestine is not as efficient because your body's kind of used to storing it and then having it go. But over time, I don't know if the ducts that go from the liver to the small intestine get bigger, if they develop more of them, but you become pretty efficient and you no longer even notice it really. But there's a little adjustment when you first, huh?
How you eat probably makes a huge difference.
Yeah, people
Yeah.
are usually on a special.
When
watch their-
you first have your gallbladder out, you can, when you eat something high fat, you can get a little nauseated from it because you're not breaking it down. But then your body, and most people, adjust, and you have plenty of bile coming from your liver directly into your small intestine. So you do just fine with it. So, what do you know about bile? Bile is yellow-green alkaline fluid produced by the liver, stored in the gallbladder. It helps with digestion. It breaks down dietary fats, allowing them to be absorbed in the small intestine. It also carries waste products such as bilirubin away from the liver. So it's got an important function. And even though we don't have a gallbladder, we do get it from our liver and we do need it in order to absorb things and get rid of waste products. So what does green, because it all comes down to green vomit. We usually don't see bile, right? We don't see it unless we throw up or we vomit. So green, when we throw up and we see that it's green and we haven't just had a green popsicle, it's likely that it's just undigested bile that's just coming up. So what would cause you to have undigested bile coming up? If you have the stomach flu or food poisoning, where you're just throwing up constantly and your stomach is empty and there's really no food in your intestine to be digested and everything's irritated and you're throwing up, you'll just throw up the bile because there's no job for it to do. One of the serious things that can indicate that one of the reasons if you see green, if you're throwing up green bile, one of the serious conditions is if you have a bowel obstruction or an intestinal obstruction. And so, which is just a blockage. So the food is not able to just keep passing down and you'll get a blockage and the pressure there will cause you to throw up and then bile is going to keep coming in and you'll just start throwing up bile. So usually with an obstruction, you'll also have abdominal pain. You may have extension in your abdomen. I don't know any other things. If somebody listens with a stethoscope, they may not hear bowel sounds if you've had an obstruction for a while. And you won't be able, usually you're not passing stool because there's an obstruction, so food's not getting by, so you'll be extremely constipated. Anyway, that's it. You can sometimes see bile post-surgery. So procedures involving the gallbladder intestines can cause bile to reflux or come into the stomach. And then if your stomach is irritated and you throw up, you'll see green emesis or green vomit right after surgery. When to seek medical care if you have green bile in your vomit, green bile. If you have green vomit accompanied by severe abdominal pain, what could that indicate if you have those two things together? Just talked about it. An obstruction. Obstruction, yeah. So sometimes the intestine could twist and that causes an obstruction, or there could be adhesions in there from a surgery. Adhesions are just like a development of tissue that just blocks off the intestines. Vomiting, any vomiting that lasts for more than 48 hours. signs that you're dehydrated, which mean you're getting dizzy, you're throwing up green vomit, you're getting dizzy, you have a rapid heart rate, you're not making very much urine, you're not able to keep fluid down. All of those are signs to seek immediate medical care. And then infants and babies, green vomit in babies is considered a medical emergency as it often indicates a twisted bowel. Any questions about vomit?
Question about,
Yes.
okay, I was told that, like, I knew a person and they passed a lot of gas. And that ended up being a symptom of having gallbladder issues, and they had to have their gallbladder removed. Have you ever heard of that?
No, I have not heard of that.
Oh.
Usually you get severe pain in the area where the gallbladder is.
Yeah. That's what I heard.
I'm just wondering if when you get food poisoning, you don't get 2 days later. They're usually within an hour or so. Is that true?
There's different kinds of food poisoning, and some of them you'll get symptoms within a couple hours. Sometimes it could be 12 or 24 hours later. So it depends on the type of bacteria and what a potent influx of the bacteria that you got. Good question.
okay.
The question was, how soon do you get symptoms when you have food poisoning?
Not a good discussion before lunch.
Okay, well, let me just, have we adequately grossed everybody out?
That was our goal.
That was the goal. There was a disclaimer. Please, no one crying. There's a great lunch to be had. But let's talk about something fun. And I discovered, I think most of us are around my age, maybe a little bit older, a few students a little bit younger. When we think of green M&Ms, I'm not going to ask the students, let's ask us. Do you remember when we were in high school or in college what green M&Ms meant?
I didn't know this. Carrie was on the wild side in college.
Reiko. Yes, yes.
Say it for the viewers.
So Reiko said, I didn't say this. It had something to do with sex. So green M&Ms, this is back, okay, the green M&M is a widely recognized as a pop culture symbol of femininity, flirtation, based on a 1970s urban legend as an aphrodisiac. Now, when I was in high school, it was the biggest joke, like, who's going to eat all the green M&Ms, you know? But then I asked the students, and they're like, I have no idea what you're talking about. And I'd say, text your mom. And they're all like, oh yeah, my mom said that, yeah, they were like whatever. So originally branded in 1997 as sexy spokes candy, she represents confidence. The green M&M represents confidence, although she was recently redesigned to have a more inclusive, less overtly sexualized image. But I think we should still be very careful of green M&Ms and who you're with when you take them. From my generation.
What do they do to make her image more inclusive?
Well, let me just say, in 1970s, there was no image. We just all knew green M&Ms. And to be very careful.
Never heard of.
I never heard of it.
Really?
Because we didn't run in a wild crowd. Carrie.
See, Mark knows. Yes.
You guys are like young.
Ron is blushing. So.
Ron knows.
I know.
I asked Sharon if we should be serving green M&Ms, and she said no.
No.
Because of the saturated
Fat. Not because of the,
They'll make, they have bags of just green. M&Ms. We have her out now.
Around St. Patty's Day. So now you know.
She's going looking for it. She's going to the dollar store and she's going to find those green M&Ms. Okay. All right. Here's another question for you. What is something that we all have at times and is described as being green, but you can't actually see it or hold it?
Envy.
A little clue.
He just said it.
What did you say?
Mark's-
Envy.
Yes.
Yay.
Ew. Green with envy. Yep.
And that's not an aphrodisiac.
So I want to just briefly talk about envy because we all have it at times. So the Greeks believed that envy and intense emotions caused overproduction of bile, leading to a greenish tint of the skin. William Shakespeare referred to jealousy or envy as a green-eyed monster in Othello and described envy as sick and green in Romeo and Juliet. The experience of envy is it's a common feeling and is rooted in what? Comparison and want. We are right now as a culture, we are overloaded with comparison because of all the social media stuff. So envy has gone up recently because of social media.
What about the grass is always greener on the other side? Very good.
Yeah, that's another one. Are you going to talk about that,
No.
Carrie? Oh, no. You don't have something prepared for that? Oh, okay. No.
Repeat it for the readers.
The grass is always greener. We're not going to discuss that because Carrie.
We're not prepared
Carrie's
for
not
that
prepared.
question.
So what is envy? I think it's an important thing just to spend a few minutes talking about. Envy is our perception that another person possesses desirable traits, possessions, or status that we lack. It's rooted in social comparison, a feeling of injustice, or that we are not as deserving, that we're not of great of value because we don't have these things. But the problem is, and we all have fleeting envy, a little, oh, we're envious of that dress that somebody's wearing or the joke that Carrie told, that kind of thing. But it passes. But if we hold on to envy, that's when it can become the type of situation where it can actually make us mentally feel depressed or anxious, not of good enough. So it can lead to resentment, bitterness, a desire for another person to lose what they have. And we just are stuck ruminating in our brains with that. Our brain gets attached to it. So how can we deal with envy in a healthy way? Because we're going to have it. Envy's going to come. How can we not hold on to it? The first thing is to just acknowledge our feelings. When we try to push something away, it's like it makes us feel bad about ourselves. Well, I'm feeling that. I got to get rid of that. I shouldn't be feeling that. So the first thing is just, except for Tom, he's not going to, I know, Tom, you don't want to acknowledge that, but acknowledge your own feelings about whatever it is that you're feeling some envy. Talk to a friend about it, and then the important thing is decide how you will respond to the feelings of envy. You have a choice. When something happens, when a feeling of envy comes up, you have a choice with how you're going to respond to it. We can choose to lean towards self-criticism, feeling like there's something the matter with us, feeling like those other people always get their way, they always get what they want, kind of separating ourselves from people and isolating yourself. We can feel angry, or we can feel less worthy. Or that's a choice. We can choose to go there and spend days ruminating on it, or years, or we can lean toward admiration, inspiration. How about if we're inspired by somebody that has something, or is doing something, or has something in their life, or has the way that they're doing their career? What if we're inspired by that and we're motivated by that? And what if we're so inspired and motivated by that we ask them how they were able to accomplish these things? And then what do we have? We have a connection with them, right? How different is that than feeling anger and worthlessness and antagonism, right? And we have a choice with how we deal with, because we're all going to have envy. And it's going to be in our face more than ever these days because of social media. So notice and focus on what you have in your life that is good. reminding yourself of all the things that we do have that are good. Maybe we don't have that house up on the mountain, in the mountains, or on the beach house, which is what I am always envious of, the house at the beach. But notice what you do have. You know, how wonderful the house that you do have is, or a room in your house that's wonderful. Focus on your own goals and your own journey. We all have our own journey. We have things that other people don't have. They have things that we don't have. If you see somebody that has a success at something and you're envious of it, use their success as proof that it is possible for you. If you see somebody in here that's able to exercise 45 minutes and not get short of breath, and you have that tinge of envy, use that as proof that they were once here 2 years ago and just starting, and they've gotten to this place, and that maybe you can get to that place too, or get to your own place, your own path, but you can improve your health and connect with them and talk to them and find out how they did it and what they're doing and what they're thinking. So learning from others allows us to connect with other people so we don't end up just isolated and alone with our envy. And reframe our perspective. We don't really know what's going on in other people's lives. They may have on the cutest dress in the world or have perfectly behaved children, but we don't know that there's, an alcoholic husband. We don't know that they lost their job. We don't know all the other things that are going on that we have. We're just assuming that if one thing is good, all the things are good. And that is never true. Never true. So I'm going to end this little part here with learning from others is a gift. It is not a weakness. So if you're envious of somebody or something, try to learn from that person about it. Yeah.
Better envious. We used to go in Hawaii and we'd stay at the Hilton. And my friends stayed in their house on the beach, which cost more. And they would let us stay there one night and it was terrible. Why would you want to be there at night? You can't see the ocean, you can't see the waves.
Right. So the grass was not greener. Yeah. Yeah. That's right. That's the whole point. You don't really know what you don't know. So Leonie's talking about that she went to Hawaii and they always stayed at the Hilton, which sounds horrible, by the way. And then, but she was a little envious of these friends of theirs that had a house on the beach. But then one time they stayed in the house on the beach and she didn't like it. She found out it wasn't all that great. Couldn't even see the ocean. Okay. I'm just going to end. We're going to end with this. What is something green that is healthy to have in our body? And you guys should all know this because Debbie spoke on Tuesday about this. Yeah. Green food. This is something we want to have in our body because as Debbie talked about on Tuesday, eating greens and having greens in our intestines and getting absorbed into our body helps with our heart health, our weight management, our bone health, our eye health, our immunity, helps with our diabetes management and our iron levels. Okay, any questions or comments? You guys are all educated on green now.
Yeah, are you hungry though?
Yeah,
Okay.
I think they're ready over there for
Are you
you.
guys ready to serve lunch? Okay.
Okay, thank you everybody
Thank
for
you.
coming.
It's fun, Sharon.
It's always fun to do it together.
Yeah.
I managed to restrict my comments.
Yeah. Did you want to? Land?
I'm green with envy.
Yeah. Oh, I wrote it last week to, so we read this big piece of paper. I have no idea. Well, never. I can't even guess.
Is this yours, Sharon, this big piece of paper? No. Has it got my writing on it?
No, I don't think there's any.
Put it there? Oh, they taped it. Well, it's that sticky. Is it? Yeah.
Like they wanted it to stay that way.
Very good, Sharon. Thank you.
I like it when you guys tag team like that.
Yeah, it's
It's
fun.
fun.
You guys have a plan for April?
Huh?
What do you think about it? Do you want us to do it together? You want it separate?
I just wanna know what we're gonna do.
April showers bring May flowers. What do May flowers bring?
Weddings?
Pilgrims.
They do? Oh, the Mayflower, the pilgrim? Maybe you give that lecture. That'll be it. Just say that.
No, I give a one-liner during real lectures, yeah.
Depends on how many lectures you need for April. If you don't need